Hi, I'm Dr. Obermeyer, and the purpose of this video is to discuss shoulder pain in the form of rotator cuff tendinopathy and impingement. One of the common sources of rotator cuff or shoulder pain is an injury to the front part of the rotator cuff tendon, where the so-called supraspinatus tendon inserts onto the bone. This tendon can be injured as a result of injury, trauma, degeneration, or vascular impairment, and can cause resultant shoulder pain and difficulty with activities. One of the other types of injuries that occurs at this location at the shoulder anatomy is a rubbing process where the tendon of the rotator cuff becomes impinged or rubs on the upper portion of the shoulder bone called the acromion. This lesion can cause pain, difficulty with activities and reaching, and can later lead to tearing, fraying, or sometimes complete ruptures of the rotator cuff tendon. One of the common sources of pain also includes popping and clicking at the bursitis or fluid sac that occurs as a result of the impingement process. The diagnosis of rotator cuff tendinopathy is generally made on physical examination, as well as sometimes with imaging that can sometimes show a signal at the rotator cuff insertion as well as fluid surrounding the tendon. Other times, a spur at the upper or acromial bone overlying the rotator cuff tendon can also be evident. The treatment for rotator cuff tendinopathy depends on the extent and severity of the pain as well as imaging findings, and oftentimes is treated with a combination of injection-based treatments, modifying activities, and strengthening of the surrounding musculature, including the rotator cuff and the muscles surrounding the shoulder blade. Oftentimes, when the tendon is not significantly damaged, and when the pain has been refractory or not responsive to a course of exercise-based treatments that focus on strengthening the rotator cuff musculature as well as the muscles of the shoulder blade, and other treatments including injection-based treatments, medications, and activity modification have not been helpful, there may be a role for arthroscopic surgery. Arthroscopic surgery utilizes a camera to decompress the upper portion of the shoulder bone that can be a source of impingement or pinching of the underlying rotator cuff tendon. This can effectively alleviate the symptoms, allow a full and pain-free range of motion, and also permit other evaluation of pain sources in the shoulder, including the rotator cuff tendon itself, as well as the adjacent biceps tendon. Please visit our website for more information and contact the office today if we can be of assistance in your quest for pain relief as a result of rotator cuff tendinopathy.